So first of all, I'm Jessica Cole. I'm your director for UWHR Work Life. Like I said, we'll be focusing on KinderCare, Bright Horizons, and UW CareLink benefits, but please go to that website to learn more about all of the different caregiver, childcare, and elder care resources that we do have available here at UW. I do need to do some housekeeping items before we start. Like I said, we're recording the webinar today. We hope that you'll keep yourself on mute during the presentation, but you can go ahead and put any questions that you have in the chat. We have Nicole here to be our chat moderator. Thank you so much, Nicole, for being here to help us out today. We will have the last 10 minutes of today's event for questions. Each presenter will have 15 minutes to do their presentation piece. And then we'll reserve that final 10 minutes for all those, I'm sure, questions that will come up. We want to make sure those get answered today. Without further ado, I would love and am honored to introduce you to our panelists today. We have Keith Burns here from UW CareLink. Keith is our Senior Account Manager at ComPsych. ComPsych is our vendor for UW CareLink services. We have Cindy Lux from Bright Horizons. Cindy, you want to give a wave? Cindy is the Director of Client Relations at Bright Horizons. Thank you for being here today, Cindy. We also have Pat Dillon and Paula Hartman from KinderCare. Pat is our Senior Sales Executive, and Paula is our Account Management Project Manager. If you two will give a good wave to the audience, and Keith, if you'll wave to everybody too, that'd be pleasant. Thank you. Without further ado, I'm going to turn it over to our panelists because that's who you're here to see. We'll start with Keith Burns from UW CareLink.
All right, thanks, Jessica, and thanks everyone for joining today. Jessica, can you see my screen okay?
Yep, perfect. I sure can.
All right, so I am going to walk through today the various resources that we have in place through the CareLink program, specific to child care support. So as Jessica mentioned, this program is part of a broader offering. But again, for purposes of today's discussion, I'll be walking you through the CareLink Child Care Support offering, and I'm excited to be here. So thanks everyone for joining. So a couple of things when we talk about the CareLink program. First off, I'll highlight that the program is available to CareLink employees and their household family members. So really kind of loosely defined as anyone living under the roof of your home. So spouses and children being the obvious ones, but even if you're caring for somebody else who might need support, we can provide that support as well too. Now, when looking at specific child care examples, I was going through a slide deck that I've used in the past, and trying to pare it down for a session today. But when we look at child care, there's multiple different ways that CareLink can help support in that arena. So whether it be finding family home care, local daycare centers, preschools, nanny care, backup and emergency care, even locating summer camps. So this is the time of year for summer camps. The program can support as well too. And this is a live access program. So when I say that, I mean that the program is or these services are provided via the CareLink toll-free number, answered live 24 hours a day, 7 days a week. Now, with a child care call, what we'll generally do at intake is gather as much information as we can based on your specific request. In a little bit, I'll pull up a sample of what a child care packet will look like that you could expect to receive. We also have a full suite of online tools. So again, uw.guidanceresources.com is our employee-facing website. Highlighted some of the child care specific resources on your screen there, but tons of information out on the website as well too. So I'd encourage you, if you haven't had an opportunity to, jump out on the website at your convenience, set up an account. That way you're all set should a child care need pop up in the in the coming year, and we'd be happy to support. I did mention our website. So as you see there at the bottom of the screen, uw.guidanceresources.com is the place to go. A first-time user will have to enter their web ID. We've made it convenient. The web ID is UW. From there, you'll set up your own username and password, and then subsequent logons, you'll just have to use that username and password to get in. So again, that web ID is only used for first-time users of the site. We also do have an app that's available on both the Apple and the Android store. So if you were to go out to either one of those stores and search Guidance Now, you will see the app. directly imitates the live experience for if you were to visit the site via via a laptop or tablet. Within the site, we've got all kinds of resources specific to childcare. So we've tried to be very diligent in organizing those resources by by specific life events. So in this situation, if you've recently had a child, we've got a ton of different resources out on the website as well too. You can also do some zip code searches from our website as well too. So if you wanted to, kind of start your search for childcare facilities on your own, I'd certainly encourage you to give it a shot on the website. And then if you decide that you want to contact one of our consultants so we can begin building your childcare packet for you, again, we're available 24 hours a day, 7 days a week. Um, during the intake process for a childcare call, we're going to gather all the relevant information based on your specific needs. So, age of the child, location that we need to search. Do you need a facility with early drop off or late pickup? Is there a special dietary or educational requirement that we need to be aware of? So again, our childcare professionals this is what they do on a daily basis, service these types of needs. So I'd encourage you, if you have a childcare need, to provide as much information to those consultants as possible. And then we're going to begin assembling a customized packet based on your very specific requests. So again, we're not pulling a child care packet off the shelf. We're designing this packet specific to your need. So I thought it would help during this presentation here to give you just a walkthrough of what a child care packet might look like. So again, after you've spoken with one of our child care consultants, you will receive in the mail or via email, however you'd like, about 3 to 4 business days after the call, the child care packet specifically designed towards your request. So in the example being shown on the screen there, the scenario being played out is that the husband and wife are expecting their first child, not sure what their options are for childcare. We got specific information about, the type of need that they're looking for, obviously area that we need to search. They're looking for both nanny agencies and family daycare providers. So again, this is all the information we're going to gather at intake, and then we'll begin assembling that customized packet based on the results or based on the information that you gave to us. Now, generally speaking, a child care packet is going to include about 3 to 5 different child care facilities that meet your need. So again, important to highlight here that we are assembling this packet specific to your child care request. So again, 3 to 5 child care facilities in the area. In this specific request, it was in Massachusetts. We're going to proactively contact the facility to, one, make sure that they have availability, two, also gather any other information that was relative to your specific needs. So, think centers that offer early drop off or late pickup, or there's a dietary or educational requirement. We're going to gather all that information. During the past, 18 to 24 months, many of these facilities may have had to operate at less than full capacity. We'll gather anything related to that as well too. Um, Gather information on age accepted, hours of operation, pricing information if the facility is willing to provide, different activities that are available, and then any other relevant information about the center. So of course, the website of the center, any information that we can gather for you will be included in this packet. Again, I mentioned 3 to 5 different childcare facilities that met your specific needs. Again, these are vetted, so we know that these facilities have vacancies at the time of our call and that they've met any of the other criteria that you've given to us. Now, as I scroll through the request was for not only childcare facilities, but also nanny care as well too. So we've included that in this sample packet as well too. Now, as I scroll through, when we get to the end of the actual results of our search, we're also going to include different help sheets related to the call. So in this situation, if you remember, the individual is looking for not only nanny agencies, but also daycare facilities. So again, we've got all of the information consolidated into a packet here for the user. And as I scroll through the results of our search, I want to get to the next component of the packet that gives some other information relative to your request. So we're going to include a map of the area. So this is the map of the area that we were asked to research, and we pin those different facilities on the map for for ease of use. So if you have a need for a facility close to work or close to home, that will all be taken into account when we are performing our search. We're also going to provide you with different help sheets related to the search. So again, this was a search for the state of Massachusetts. So rules and regulations in that state, worker qualifications, etc. Also other relevant help sheets. So outlining different childcare options, advantages and disadvantages of both. So we've got, childcare, family daycare, in-home providers, things of that nature. So again, we want to equip you with as much information as possible based on your very specific need. With a childcare search, we'll also provide you with a packet that includes a checklist. So this could very well be the first time placing your child into a childcare facility. Questions to consider asking when you visit those facilities for the first time. So again, the packets that we provide are directly related to your specific request. So we wouldn't be pulling just a child care packet off of the shelf for you. Again, we're going to take all of the different criteria into account that you provided to us at intake. Different information on questions to ask for, when talking about references for a provider, things of that nature, and then other checklists related to the search. And then finally, as I'm kind of rolling through the rest of this packet here, I'll also highlight that this program is completely unlimited. So if we were to provide you with a child care packet and you asked us to look close to work, you decide now that you want us to look close to home or expand our search radius, give us a call. We can start the entire process over again. So there's no limit on the amount of different child care searches you can have in the queue for us. And again, we're going to provide you with all of the relevant information for your specific request, equip you with help sheets related to your child care request. So again, the goal here is to make you a more well-educated consumer. So taking a lot of the research component off of your desk, let us do the research for you. And at the end of the day, provide you with a very comprehensive package of information related to your specific requests. So again, the toll-free number for CareLink is answered live 24/7. We've got child care specialists on staff who are ready to work with you. And then, last but not least, I'd be remiss if I didn't highlight again that this is a completely unlimited offering. So if you change your search criteria, you want us to look in a different area, we could certainly support with that. And in addition to those facilities, we'll provide you with a whole bunch of other information relative to that specific request. I will go ahead and stop my share, Jessica, and you can pass it on to the next.
Nice work, Keith. So just for reference, UW CareLink is not just this family source offering that Keith is talking about. It has different programs, including counseling benefit, legal benefit, financial benefit, and am I missing anything, Keith? Some manager support and such.
Yeah, manager support. And then, that child care packet falls under our work life. So, child care, moving and relocation, things of that nature. So really anything on your personal to-do list are also included with the program.
Yep. I did put in the chat that we do have a get to know CareLink, UW CareLink offering for webinars if you want to join us to learn about the whole offerings of that program. It is for PEB eligible employees. So for the students on the call, I'm sorry, it is not available for students at this point. It's through the PEB benefits for employees. So we're a little bit early, but let's go ahead and transition to our next speaker. Cindy Lux, are you ready to go? Maybe you're muted, I'm not sure.
Yes, I couldn't find the unmute button, sorry.
It has to happen.
It was just here a second ago.
It has to happen in every one of these events. We have to have someone on mute. All right,
okay.
Cindy,
can you see?
Yep.
All right, excellent. So thank you everyone for having me today. I've got a lot to go over, so I'm going to move through rather quickly. I know we're having some questions at the end and hopefully we'll get to everyone. Otherwise, I can certainly follow up with Jessica with anything outstanding. But if you are a parent, you know that school holidays come out of nowhere, teacher conferences come out of nowhere, or maybe your caregiver all of a sudden calls in sick and you need some support for your family. What Bright Horizons is here to do is to help you fill those gaps in care. School is out for the summer, yet your camps haven't started yet. You have a caregiver for an adult elder and that caregiver goes on vacation. So there's a few different ways that we can support you. And the first is through the backup care program. We've delivered 5 million days of backup care in our history. We've been in the family care business since 1985. We started out with the development of childcare centers. I'm sure a lot of you are familiar with the Bright Horizons centers. And we've then since grown to include backup care for both children and adult elders, and have moved to have some ancillary supports too, to help you support your family in every way that you need. So first we'll go over backup care. As mentioned, backup care is there to fill gaps in care. So school's on break or your caregiver cancels, and you need to provide support for that person because you need to get to work. We deliver backup care through a number of different ways. First are our backup care centers. So there's exclusive access to Bright Horizons centers through the backup care program. And we also have a nationwide network of vetted partners. One of our biggest ones is KinderCare, also on this call, that you're able to use through the Bright Horizons program. But there's many other partner centers in your area too that will come up when you do a search to reserve backup care, and we'll go through that in a little bit. As another option, we have in-home caregivers, and in-home caregivers can be for children or for adult elders. If it's an adult elder, that person can live anywhere in the country. So if your parents live in Arizona and you can't get there for the day, and your mom has some surgery and she just needs some help for a couple days, you're able to have us do a search for an in-home caregiver that can go and help her get around the house and fix some meals and do some other things to support her. Also during summer and some other breaks like winter break and spring break, we have school age camps that are part of the network. So you'll see those come up on your reservation list if you search during those times. And for the summer camps, they're pretty much running through June 15th through around August 15th. So you'll see those as an option. For in-home and adult elder care, again, a nationwide network. We can care for any adult family member. Many people use this, as I mentioned, if there's been some kind of minor surgery that the person just needs some help around the house, a caregiver's on break and you need some help, recovery care, or even companion care. If no one's going to be in the house for a few days and you just want to make sure that everything's going okay and dad's eating properly, you can have somebody go in and make him lunch, make him dinner, and do some light housekeeping. It's a great way to make sure that your parents or any other adult elder that you're responsible for can be taken care of. It can also be used for adult children. So if you have a child 18 or over that 18 or over that maybe hurt themselves playing soccer, and then you need to go to work and they need some help for the day, you can have somebody come in for that as well. We have a link that has access to all our health and safety protocols listed on here. And I think that this is going to be shared once the presentation is over, so you can have that link. It's also on all of our websites. Something University of Washington added this year is a reimbursable care option that you can do as an option to either in-home care or center-based care. It used to be that we would search for a network provider first, and then if we couldn't find one, you could use reimbursable care, but now you have that as an equal option. So when you go in to make a reservation for care, you'll see 3 buttons that come up. One is center-based, one is in-home, and then one is reimbursable care. So if your person that needs a caregiver is mildly ill, this is a great option to use. If you want to go to a center, but that center is full, or your car breaks down and you can't get there, this is a great way to still use the service. So this is when you use somebody from your own care network and you get reimbursed for $100 for that day of care. So again, it's just a nice way to have an option to use. So if our caregivers in our network aren't available or they aren't convenient, you're able to use someone from your own network and get reimbursed for that $100. And it's pretty simple to use as you walk through it. It's pretty intuitive. You'll be prompted to fill out 2 forms. The first is a confirmation and release form, and the second is the request for reimbursement. You have to complete the release form prior to receiving the reimbursement. So you just read and acknowledge and enter your name and the date, complete the request for reimbursement for the days that you had care. You must do that within 10 days of the last day of care in that reservation request. So just make note of that. And all of that comes up as pop-ups as you go through the process to reserve the out-of-network or reimbursable care. So how do you access the backup care? So there's one landing page for all of the services that we'll talk about today. So this URL that's up here, clients.brighthorizons.com/UW, is where you'll access all your benefits. Backup care is one of them. You'll click on the backup care icon. You'll get a screen that says sign up. So if you've never registered before, make sure that you click the either new user or sign up button. And then if you're prompted, you put in your username, first-time username and password that you see here on this slide. And then you're able to get into the system and fill out your profile and put in the username and password that you're going to remember. You can either reserve care through our website. There's also a mobile app, or you can call our contact center at any time, 24/7. With the Bright Horizons backup care benefit, you get 5 days per calendar year. You have co-pays, so center-based care is $20 for a child or $35 for a family, which is up to 3 children. Did have a waived copay for center-based care for March and April, so a few more days that you're able to take advantage of that. So you won't have to pay that $20 or $35. The in-home care is $8 an hour for up to 3 care recipients with a 4-hour minimum. You can reserve backup care for up to 60 days in advance. So if you know that there's going to be a school break, it's great for you to get in there early and get that reservation. And you have to give us a cancellation by 5 p.m. Starting May 1st. It's actually, I have April here. No, starting April 1st. Sorry, I didn't update this from when I last did this presentation. The cancellations must be received by 5 p.m. 2 days prior to the reservation. And again, you'll get all those pop-ups when you go into reserve care, so you won't be caught by surprise. All right, how am I doing on time? 5 minutes. All right, so that is the backup care portion. Next, we'll go over the enhanced family support portion. And this is safe accounts and access to premium quality education and care services, all through that one landing page that I showed you before. So the program provides you with a menu of options that you can self-manage, self-control, and you also self-fund to help you with whatever you need for your family support. So 4 different categories here. Primary childcare. You have priority access to Bright Horizon centers. So if there's a wait list, you'll move up ahead of the people in the community that are on that wait list for the center. You also have sitter and nanny search tools through either Sitter City or College Nannies. The nanny placement discounts are through College Nannies. And then there's different camp options for school breaks too, things like Steve and Kate's camps that you might be familiar with. You'll also see some options for before and after school care. We also offer a lot of different support around academics. So we work with different companies like Sylvan Learning, Varsity Tutors, that you'll be able to get discounted both in-person and virtual tutoring and test prep. And then for your younger kids, there's also some different learning enrichment tools that you'll be able to take access to, like Code Ninjas, and there's a few other ones too. For elder care, part of this Sitter City service has a resource called Years Ahead, which helps employees understand what care their aging relatives will need and helps you find the right resources and caregivers for that. So you'll also be able to get guides and resources that are in your area off that Years Ahead app through Sittercity. The Sittercity database also offers all different household supports for pet sitting, housekeeping, specialized care. You just go in and put in either a job request or you do a search for something that you're looking for, and the different people that can support you will come up in that search. Again, you access your benefits all through one landing page. This is what it will look like. For the backup care, make sure if you're a first-time user, you click this register button before you put in that first-time username and password. If you're already a user, you'll just click that sign in button, or it will probably automatically populate. So when you click that new user button, you will put in the employer username and password. That's right over here. And if you need any help, just please contact the help desk through there. That's the fastest way to get the support. And if that doesn't help, just reach out and Jessica and I can help you out. As far as all the other supports, this is also a picture of the landing page. So you can see, you can find the sitters and nannies. This is all Sittercity in here. This is college nannies and tutors for the nanny placement, before and after school care. So you click details on any of these and you'll see what company it is and what's available for support. And then you click use it and you'll be brought to the Bright Horizons landing page for that benefit, and you'll be able to access your discounts. So important to note, if you're going to Sittercity, don't go directly there, go through this landing page and you'll get that initiation fee waived, or your annual fee waived. So pretty easy. And again, you can always call us if you have any issues.
Thank you, Cindy. Now we do have 5 more minutes allotted for this presentation. Did you have anything else that you wanted to go into additional detail for?
I think we could save it for Q&A.
Yeah, it looks like we have a lot of questions coming in, so the extra time would be good to have. All right, so we'll turn it over to Pat with KinderCare.
Hi, everybody. Perfect. So Paula and I are on this call, so thank you, Paula, for joining. So Paula and I partnered together with University of Washington within the program that we're providing for you. Go ahead and go to the next screen, Paula, if you have access to it. KinderCare, we're focused more on child care centers. So KinderCare has the largest network within the United States. We're within actually 40 states now and almost close to 1,600. This is a little bit older slide. And we also have support through our ancillary programs with our partner with Champions for before and after school care in a lot of markets. So there's a lot of different options of how you can access us and use our services moving forward. Go ahead and go to the next slide, Paula. So one of the big things that we did during COVID, and one of the things we're most proud of, and we actually just got some recognition around, was our health and safety protocols. So we have kept our centers open for the most part through the pandemic. We actually narrowed our center focus down to healthcare for quite a while, but we opened up back in June of 2020. Once the COVID part of it started to wane a little bit. But what we've done and we've been recognized for is the ability to do these types of things within our centers to ensure that the health and safety for our centers is at the highest level possible. And we have a link down at the bottom. You can find out more, and we'll share this with you afterwards about how we can support that further for your young children. So KinderCares, we typically focus on infants to pre-kindergarten age, but we also have school age programs through our partner with Champions, and some of our centers also have before and after school care programs for school age children as well. Go ahead and go next one. So we wanted to highlight this because we also have some upcoming programs for summertime, and we know that that can be a big time for families looking for support. Through our Champions program, we have Champ Camp, and then we also have for our younger children, we have summer programs that we can do for babies to preschoolers. If you want to learn more about what that looks like, let us know. We've shared some information with University of Washington previously around this, but I'm happy to share that out so you can have some more information around what that looks like. So I'm going to get into the 3 benefits that we provide. So we provide a tuition benefit discount program, which is a 10% program that goes across our entire fleet. So if you have family members that live in other states that are looking for childcare, definitely look for a KinderCare within those markets, and we can provide that. If you have other, University of Washington may have employees that are working with other states doing research remote. They can definitely take advantage of our fleet in those particular markets as well. This link down here at the bottom, which is our link specific to University of Washington, is the best way to access research around that. It also ties into the other benefits that I'm going to share here. Go ahead, Paula. So we also have a backup care program with University of Washington. Ours is a direct in-center backup care program. There's a couple of key things that I want to point out. So if you're within the market, you do have 10 prepaid backup care days per child that you can take advantage of. Our copay is $20 within the centers that we have accessible within the market. And it's a matter of either calling us directly or using the link to do some research to determine what might be the best center to take advantage of. We do this at a different price point than some of the other parties within the call. So it's definitely worth looking at and seeing if we have availability so we can take advantage of that for you moving forward. The other thing I wanted to point out is within the Seattle metro area, we set up some exclusive priority waitlist relationships. And these are the centers that are listed down here below. So you can see that there's a significant amount of centers that may be available to you that if you're looking to try to get your child into one of our centers, it's not a national or a global priority waitlist, but it is specific and exclusive to University of Washington that you can take advantage of. So through our website, you can research this, you can make some calls, you can determine how long the wait list is, especially at different age groups. As you can imagine, our centers are filling back up, but we have some availability. So I would definitely encourage you to take advantage of that and look at and see what might else be available for you. All right, so we can go through a little bit about how it works. So I talk about the link. We have some of these screenshots down here. So this is an image of your web page and what it looks like for tuition benefit, and then you can do some searches. So one of the big searches you can do is you can find a center. So we encourage you to look at that, put your zip code in, determine whether you want to have your child closer to home or closer to work. It provides a lot of flexibility for you when it comes to that. And then we also have a small screenshot here that shows some of the availability within the market. So once you go into this part of it, you can click on those and then you can choose, okay, I want to pick, Seattle KinderCare, for example. You can click on that and you can look up who the center director is, contact them directly. They're going to have the most current information around availability. And they're the best option for you as you're going through this type of research when you're looking for childcare with us. All right, so backup care. So very similar, same link. Click on the backup care tab here at the top, and then it'll take you into this description of what's available. And then you can click register. And when you click register, then it's going to give you some options to create a user login. So through our network, we want you to register here, for either register or log in, depending on where you're at within the process. And then that'll give you complete access to making sure that you have access to the contact. If you have any questions, our 1-888 number is down below. And we also have an email that you can send an email to as well. Both of those are good options if you run into a problem. So when you're going through the process, obviously it's going to auto-populate with the University of Washington. We're going to take you through a safe registration protocol so you can put in your information, including employee ID, your address, whatever it is that you feel is appropriate to include right here. And then as we move forward, Paula, then it'll show you, okay, here's some availability within these particular locations and how many you have left as far as allotment goes. So when you have 10, then it's going to give you the countdown. We're tracking all of this stuff on our side when it comes to in-center childcare for backup care. And scheduling. So now we're talking about the process of how do I decide where and what days I need to register for. So you can do this on the system and pre-register for the days and the dates that you require, knowing that you may need them relatively soon. A lot of times in these particular cases, this is something that's planned out. It could be a spring break. It could be something else that's coming up here in the near future. And you just want to make sure that you have some coverage. Some quick highlights here. Obviously, registration doesn't take very long. You can do it honestly 24 hours a day, 7 days a week, because it's an application on the website to take advantage of it. And you can do it up to 30 days in advance. So that's our one criteria that we have to put in place right now with KinderCare is that 30-day advance notice. If you have any questions, we have availability through our phone center to the 888 number. So feel free to reach out as you need to, and we're happy to help support you with that part of the process. And I'll pause there. Hopefully, Jessica, to give us some more time for the Q&A. I know we have 19 questions in the chat, and I'm sure other people have questions as well.
Great, thank you so much, Pat and Paula. I appreciate that. I also wanted to point out, I'm a parent of 3 and I have used the backup care many times. It's a very good idea to register your account and get it all set up well in advance of needing it. Sometimes we have to verify your eligibility and that can take a couple of days. So if you are thinking about it today, get signed up for the Bright Horizons benefit and the KinderCare benefit so that account is ready to go when you need it. Nicole, did you want to walk us through the questions that have come up?
Well, I can try. There were a lot of really great questions here. Some of them are not specific to the presenters, so maybe you can just jump in as you see fit. And I would just say, as an aside, Jessica, to comment on yours, I am also a parent and I have known that there were these kind of benefits available, but never used them. And I could just kick myself for never having done so, because these benefits are available to us as employees and as student parents, and we should use them when needed. So amazing. I'm so glad I sat in on this. So let's see. I tried my best to answer some of the things in the chat, but the first question was, will we be recording this? We are recording this. We will share it out for anybody who wants to watch it again to capture some of that information or share it with colleagues who may find this beneficial. Someone asked if the slide decks will be available. I don't know, but as you answer the questions, the other questions on here, you can let us know if your decks are available for general consumption. Jessica mentioned that the CareLink seminars are upcoming. We'll drop those in the chat again for you before we close. The next question, are child care providers required to meet certain state and/or federal standards? If so, does CareLink take this into consideration when recommending facilities? Keith, I think this would be a question specific to you.
Yes, yeah, and we do vet those facilities, so there certainly are, state requirements that they do have to meet. So we would only be providing within that child care packet facilities that do meet all the state regulations. Absolutely.
Thank you.
Sure.
There was a question about backup childcare being available to student parents. The answer is yes. There's some additional information on our website about how student parents, particularly those who are not GAIP or graduate assistant insurance participant members, can access the care. Jessica dropped the link in the chat. We can put it in again if you need it. Another question, I've used backup childcare before and it seems like you can actually reserve it in advance, which we found out is true. But you only find out the specific facility the day before. When I've used it in the past, they choose the most available child care center, which sometimes is in an inconvenient location. Is there a method for finding out the facility more in advance than the day before, and then canceling it if it doesn't work well in terms of location? So maybe Pat or Paula or Cindy could address that. Managing location?
I can address them. Go
Go
ahead,
ahead,
Matt.
Cindy.
Okay.
You talk from Horizon's perspective, and then I'll share KinderCare.
Okay. Okay, for Bright Horizons, when you go into make a reservation, you can put in your preferred centers. So you can put a list of 3 centers that are preferred. If we know we have space available in that center, you'll see something that says book now. So hit book now whenever you can, because that is a great option to be able to have, and you'll get an immediate confirmation. If you don't see that book now, it means that we have to search and we have to check with all of the centers to see if there's space in that for that day. And sometimes that takes a little bit longer than we would like it to take. We try to get back to you within 48 hours of you making that request, or quicker if you had to make the request the day before. So we do our best to get back to you as soon as we can, but a lot of times it's because we're still searching and waiting to see if there's space.
And I would add from KinderCare's perspective, ditto on a lot of what she just said, but similarly, we're going to try to put you in the center that you want to get to, if we can make it work on that day and in that age group that is available. If it isn't available, then we are going to try to find the closest option for you to take advantage of on that particular day. And we'll just continue to work with you on that. So we have a dedicated team within KinderCare that would reach out to you and try to help support you and determine what's the best option, because obviously you need that care on that particular day. We may not be able to provide it within that particular location, obviously because of state licensing and requirements for ratios and all those different things that factor into those parts of the conversation at that point. So we will work with you as quickly and as efficiently as we can to find a viable option within the network that we have available.
Can I add to that question, please? So if the center that is offered is not desirable by the person, by the family, will they still be charged fees or for a use if they cancel last minute?
If they cancel last minute with us, we don't charge.
Okay, thank you.
Mm-hmm.
Thank you. Thank you. The next question was, is there an option to use backup care for more than 5 days per year, maybe at a higher copay? 5 days gets used up quickly. Cindy, I think that would be specific to you since 5 is your policy.
Yeah, and that 5 days is set by UW. So, and you are not able to use any of the Bright Horizons centers or our network centers outside of that program, with the exception of what you have through KinderCare.